All right, y'all. Residency reflection week 16. I'm only got, I think, 2 or 3 more weeks left in acute care, done at the end of January, and have the live patient exam coming up this week, which is like our overarching like clinical assessment for the rotation. So a little nervous for that, doing some studying and things like that. But in terms of this last week, it was kind of the first week I was able to get back into all of the residency stuff after the craziness that December brought with, we were finally able to get back into the mentor sessions and things like that. We had a Neuro Consortium module day all online yesterday on Saturday from 10 to 7, a super long day to be online, but it was actually really engaging and really fun, and I got to learn a lot, and I actually wasn't just dreading sitting there for that length. Usually if I have to sit at my computer for more than 2 hours to watch anything, it doesn't go well and I get very frustrated. But I felt really engaged throughout the whole thing, so that was nice. And got a little bit of an orientation to the IMC, the Intermediary Care unit, which is like a step down from the ICU, between the ICU and just a general floor bed. With one of my mentor sessions with a patient who was relatively medically stable and was probably going to be discharged to the floor soon. So that was a good, kind of soft introduction with a mentor there into the IMC and kind of the extra complexities that come with that. Just with like the continuous monitoring and things like that on all of the lines and machines and things like that. So that was a really cool experience. And then on my other mentor day, I got to work with one of my other mentors who I just haven't had a lot of mentoring with, and she kind of really helped me retroactively after our session kind of think through and connect a lot of the dots and a lot of the pieces into the clinical picture. And I had had an idea of what I wanted and what I wanted to look at and what I wanted to assess and what I was expecting, and I explained that to her beforehand. We went in, I did it, we talked about it, and then afterwards what I realized was that a lot of what I was saying, I was kind of using improper language or not necessarily using the right term or putting everything in like the right sequence or order. So I felt like I had a lot of dots kind of get connected in our afterwards discussion, and was able to carry that over into the Neuro Consortium module and one of the patient cases that we kind of had to present. So that was really nice. It made me feel like I made a little bit of growth this week and was able to make some connections that I hadn't made previously. Still really trying to work on improving my manual facilitation. And I think part of that is just I haven't had tons of experience, so I'm still getting more comfortable with it. And part of that is I need to start thinking a little bit better outside the box and how I can improve that with my patients and use my hands and my body positioning in ways that I'm unfamiliar with, or ways that I am less practiced with, and still be comfortable with that, and just kind of start doing it and taking a little bit more opportunity to try and think about that and think outside of the box and think outside of what my go-to positioning might be to see how I can better facilitate the patient. So overall, it was a great week. It was nice to finally get back into the meat of the residency and things like that. Going to be studying for the live patient exam coming up this week. It's kind of a big deal, and I'm a little nervous for it, but hopefully it'll go okay, and we'll be able to share a reflection on that. I'll do that one the day of, just because I feel like I might be a nervous wreck going into it. But excited to be getting towards the end of acute care. I wish I had some more time, because I'm enjoying my time here, and I feel like I want to continue to learn and have growth opportunities in this setting, but also excited to get over into inpatient rehab with I just feel like I'm gonna like that setting a lot. So excited with week 16 and to see what week 17 has to offer. That's this week's residency reflection. Thanks for watching.